That's slow. Okay. I'd like to call to order the Human Services Committee for July 20th, 2017. There's nobody here to speak for courtesy of the floor, so we'll move on to the update on Graysdale.
Okay. Thanks.
Thank you.
This is nice because I can see how bad my eyes get each month.
All right. If you don't mind, we'll go ahead and get started with admissions. As you can see, our admissions is holding steady. We are still above budget and above the average, and we currently are at a census of, 664. Getting too far away from the mic. In terms of the other numbers, if you compare them to 2016, one second.
665.
Yeah, we were 665, but we still are holding steady above 660. We haven't gone down very much, just maybe 3. But we can also fluctuate and improve the next month. Usually August is a very good month for us. We are higher than 2016 with regards to bed hold days Medicaid and also with regards to other insurance. We're down a little bit in the private pay, but we're higher in the other insurance, so that's good, the managed care. And pretty much the same in the others when compared for the 2 years. Our response rate is 43%, which is very good out of the referrals that we get. So we've been getting more referrals in that respect. Of course, the only thing with that is this year as opposed to last year, and more people who are coming into short-term rehab are staying less time because the hospitals want them to get out sooner so they can keep their diagnostic-related groups lower. And so that means less days in the facility, and that means the census kind of gets a little bit of a hit. And everybody's going through that right now, just so you're aware. If there's no other questions in admissions, I'll move to finance. Yes.
How, in 2016, we had hold for private pay, like really some big numbers of 31, 10, 39. Into July, it was 73. And, you know, this year we're at much lower numbers. Do you know what's causing that?
Well, what usually happens is that less people have decided to hold the bed. And, you know, they have the opportunity if they want to hold that bed and pay privately while the person's in the hospital because they're not Medicaid or Medicare, and they've chosen to not do that. There could be a funds issue with them. You know, but they do generally come back. They're just not holding the bed like they used to.
Yeah. Okay, so that's not a symbolism of other than personal choices that they elect not to spend the money.
Higher cost in health care, so the money has to go to other things, so they'll say, you know, well, I'll take the risk of not holding the bed.
Mm-hmm.
So,
Now, can I ask another question?
sure.
So Medicaid, does that mean Medicaid holds beds?
Yeah, but with Medicaid, you get an automatic payment of 15 days. So that doesn't, you know, they don't pay for that. That's paid for by Medicaid, so you'll still get that money.
Okay. And the people probably, after that, if they want, they'd go on private pay?
No. If you're on Medicaid, that usually means you've exhausted most of your funds.
Okay, gotcha.
Yeah.
Okay, thanks.
Yes.
Now, there used to be a bonus for hitting certain percentages. Is that no longer applicable, or is there still a bonus for hitting certain admission numbers?
It's still applicable, and it's still on for this year and this coming budget.
Okay, and it's 90% or 95%? Okay. Okay.
I think it's 90.
But we're on pace to
96 minimum,
hit that number?
yes.
Okay,
Yeah, and we haven't faltered since March 15th.
thank you.
Sure. Any other questions for admissions before I move on to finance? Yes.
How was the benchmark for admissions set?
It's the budget that's the amount of residents in the facility that they feel that we can meet, and we've managed to keep it at 660, so that's good. You know, it's probably about 28 beds less than full capacity, but we have always been able to make that mark. If we're unrealistic in the budget and we make it too high, then you'll never meet the budget. So 660 has seemed to work for us, though we're trying to work on 670. Oh, sure. Okay, any other questions before I move on to finance? Okay. With finance, you know, as indicated, we do have the numbers here. When you compare the to 2016, the cost per resident day was lower then. Of course, it was also lower cost, so there is inflation in that. We're about the same in year-to-date cost per resident day, and our days in accounts receivable is less, because I know that was a question last time, and I did address that. So we're working to actively decrease those days in accounts receivable so we can get paid for the services that we provide. Let's see. All right. Case mix index, we are projected at 0.92, so we are steadily moving up. They think that we are going to hit 1 by November if everything continues the way it's going, which will be good for our IGT next year. Any other questions for finance before I move on? Okay. Nursing. If you take a look at our nursing section, our RN, LPN, and CNA overtime has all decreased from the previous month. When compared to 2016, we're lower for RN. The LPN hours were up slightly, and the CNA hours were up slightly. So in 2017, you know, we have more hours with that. What's accounting for that? When I told you that we went down to 2 one-to-ones, we have since gone up to 10. And now we are trying to get back down again. 2 are going to come off by next week, and then we're continuing to assess them weekly. A lot of these are new admissions that have come in who have had behavioral problems, and we have to deal with it mostly behavioral problems. So we're addressing that, and we're staying on top of it so we can get it back down again. And that's a project that I actively work on myself. So I monitor it, and I make sure that the team is meeting every week, so whenever there's a reduction, we can reduce it. Okay. Any other? Oh, I'm sorry. Agency, we are also, we are down as well. We're down about 10,000 from 2016, and up about for LPNs, and up about 2,000 for CNAs. And again, that CNAs is also due to the one-to-ones, because they're generally the ones on the one-to-ones with those residents. Any other questions for nursing before I move on? Okay. Next is our compliance and risk. As you can see, we continue to have no deficiencies. We've had no complaint visits, nothing else. So we're staying in that same realm since April. And we're going to do our best to continue to have that happen. We also have our new director of nursing, Janet Harrison, who has done a wonderful job. She is pretty much all over the building since day one, and she's really getting to know what's going on with the staff and making sure that we're putting things into place to reduce a lot of the complaints. Okay. With regards, oh, I'm sorry. All right, any other questions for compliance risk? Okay. Then I will move on to quality measures. If you look at all of our quality measures, pretty much the only thing that's gone up is our facility-acquired infections from 94 to 96, and the infection control rate has increased from 4.63 to 4.89 due to residents with allergies who are already compromised with other respiratory issues such as asthma, COPD. This hot weather definitely aggravates that. In comparison to June 2016, the facility-acquired infections were at 93, so it's not that far away, and infection control was at 4.7, again, not that far. All of the rest of the quality measures are down, And if you look at 2016 and you compare them to 2017, everything was higher in 2016. We're down 3% with regards to falls with major injury, down 3% on pain short-term, down 5% on pain long-term, down 0.02% on restraints, slightly up on decline in ADLs, but like I said, that was an issue with regards to documentation, and that's since been corrected, so you're going to see that go down. Slightly up with weight loss, but then we're dealing with that as well. Psychotropics are down 3% since 2016, and they'll continue to drop with the programs that we had talked about. And pressure ulcers slightly up, and also facility acquired slightly up, but then we're working on that as well. And what we talked about with the infection control rate and the facility acquired infections. Any other questions about quality measures? Okay. Yes.
So I'm actually pleasantly surprised to see the steady decrease in the antipsychotic use of those particular medications. You think that the institution of the antipsychotic protocol is contributing to that?
Yes, it is contributing it because Dr. Halumzer has really made that his main project with regards to the doctors. In addition, we do have some residents who are coming in with antipsychotics, and we are actively reducing where we can. You know, if we see that we can, get them off that, we're going to go ahead and take care of that. So I think a combination of that plus reducing in general is what's really accounting for it.
Is there any collaboration between nursing and the committee to reduce these?
Oh, yes.
Yeah.
Everybody's involved. Nursing, the dietitian's involved, therapeutic recreation's involved, the social worker's involved, the entire clinical team.
Excellent. Yeah, and I also see you got a pretty significant decrease in pressure ulcers, too, for a nursing home. That's excellent news.
Yeah. And we're continuing to work on that with our, pressure committee. What you're starting to see, you're going to start to see that decrease, and that will affect our star rating, in the near future.
Yeah, absolutely. Yeah.
Okay. Any other questions?
Mr. Kuczynski.
Yes.
Yeah, just to follow up from Mr. Vaughn's question, you mentioned the issues you're having with the behavioral and then the antipsychotics. Now, once upon a time, we had a robust system of state hospitals. I guess my question is, maybe 10, 15 years ago, would some of these patients have been in a state hospital rather than in the nursing home?
Yeah. The nursing home
Okay.
business was very different about 10 or 15 years ago. It was primarily almost like an assisted living, and maybe some sick, but not as much.
Mm-hmm.
It was more like a retirement home. So you had a lot of walkie-talkies, and that's good and bad. Good in the sense that you had less behaviors, but if you had the system you have now in place with regards to Medicare, you'd be getting a lot less money back because you don't have sicker people. So it's kind of a trade-off.
Okay. So, we've talked about this before when it came to our prison.
Mm-hmm.
Several years back, the federal and state governments moved to close state hospitals, and those folks didn't just go away. We've seen them now manifest both in the prison population and then the nursing home population, and I think that's unfortunate, but that's just the world we live in now.
Yeah, I mean, that is it, and, they come to us, and, we also have to look at them, because if they're a danger to self or others, we can't really accommodate them because we have to think about all of our other residents. But we do our best to do what we can, since the state institutions don't exist anymore. All right, any other questions before I move on?
I guess,
Yeah.
if you don't mind, just to tag along with, with the psychotropic medications, is that benchmark set too low, given our current status of society? I'm just saying, it just seems that it's I don't want to say almost unobtainable, but to me it seems low considering what we have to deal with, and that's more people coming through the door that are already on them, and then you have to wean them off.
Right.
It's not, like you said, it's not like long-term care where we're keeping people on medication. As soon as people come through the door and they're on it, it kind of escalates that percentage.
Right, and that's why we have to get them off it if it's possible to reduce it. CMS sets the guidelines. They're very stringent in what they want in every respect, as you saw. I remember we had this conversation with, what do you mean no pressure sores or no, no one can have falls? I mean, how realistic is that? But that's what they expect from us, no restraints as well. And we just do our best to try to meet them. Okay, any other questions before I move on? Okay. With regards to satisfaction survey, we're holding above 3%, and since 2016, we've been up 0.11% in our average score. Sick call-outs are also down, and especially when you compare them to 2016, we're down about 40. So that's a good thing. And any other questions on satisfaction survey before I move on? Oh, no, I'm sorry. I already went into human resources. Sorry about that when I talked about call-outs. All right, I'll just continue unless you have any questions. In terms of our turnover rate, we are okay. RN turnover rates are down. LPN, CNA turnover rates are slightly higher due to retirements and new opportunities. Compared to 2016, we are up 0.6% in RN turnover. We're down 0.3% in LPN turnover, and we're down 3.7% in CNA turnover when you compare 16 versus 17. Any other questions about that? Okay. And then last but not least, our star rating continues to be 1 star overall, 2 star regulatory compliance, 3 on our staffing, and 1 on our quality measures. Any other questions?
Yeah, right. So getting up to the compliance risk, the complaint visit substantiated. So we've not had, if I'm reading this right, so May and June, we've not had any complaints. Is that how I read that?
Actually, you haven't had any since, hold on,
April?
April.
Yeah. So in April, we've had 1 complaint visit. Who does that bring, that complaint?
Oh, no, April, we didn't have any. We had 1 in March. Sorry, it doesn't translate to the months on the top.
Okay.
Yeah.
What does that mean? I mean, so under the April, I see 1/0. So that, well, how do I read that? Right?
Oh, no, I'm sorry. That's a mistake. That should be 0/0. That was my mistake. I'm sorry. It was an error. There was nothing in April.
So we went April, May, June without any complaints.
Right.
Okay. And then in March, we had 1
In March, we had
or 2.
2. Yes.
Okay. And then 1 was substantiated.
Right.
And-
One
and
was
who-
substantiated and 1 was not.
Who substantiated that?
That's the Department of Health.
So they did come in.
Right. Oh, yeah, and both of them, they came
Yeah,
in.
okay.
One, they didn't cite us, and the other one, they did cite us.
Okay. And then in February, we had 2 complaints, and again, 1 was substantiated by the Department of Health.
Yes.
How does that affect, and I think it's an obvious question, but how does that affect our star rating?
Well, we're currently at 1. We can't go lower than 1. So, I mean, the point system will apply to it, but if we are able to increase, because our quality measures do go up as we've shown, then that'll be taken into consideration. But the fact that it's a D level, which is only 4 points, won't count very much.
Right.
As long as it's not something higher.
Yeah, because that's what killed us was that G.
Right, because the G was equal to 20 points.
Right. Okay. Keeping track of that is very complicated.
Yeah, I'm sorry about that. I'll correct that for next month. Okay. Is there any other questions for Vice Chair? Yes.
This is more global, but the state passed the spending plan. They didn't really pass a budget yet. One of the things that we tend to look at is the Medicaid reimbursement. I don't even think they've even passed the Human Services Code yet. It's July 20th. What do they do out there? The Medicaid reimbursement. Is there any increase this year? Zero? So the plan is to keep it flat? So what was your budget plan? Was it for a state increase, or was it to remain the same for the entire year?
No, the budget plan. The budget that we put through did not include any Medicaid increase because we did not expect any. And the budget that we put through also did not really include any Medicare increase, although my understanding is there is a slight increase. But if we don't have a lot of Medicare beds, it really is a non-issue. So
Okay.
we were very conservative with our budgets and did a zero increase.
Okay, so Medicaid, I believe, is what I was referencing
Correct,
from
and
the
that's
state.
zero, and that was not in the budget at all.
Okay.
Yep.
Any other questions?
Quick question. As I look at the star ratings, I see that, we have, in the past, we've had quality measures, or rather the regulatory compliance up around a 5. And at that point, the average rating became a 4. But we've never been able to break that 1 for quality measures. Is that a reality? Do we foresee that ever improving?
Oh, yeah.
Yeah.
I mean, as you can see with the quality measures, I think we're going to be able to make it to 2 to start.
Great.
Yeah. And like I said, with Janet Harrison, our new director of nursing, she really has some really wonderful ideas. One of which is, you remember I told you where we were going around and going onto the units and basically utilizing the same forms that the state would use to kind of act like a surveyor and see where we see issues so we stay on top of that. She would like to do that with the direct care staff. She would like them to act like surveyors, so this way they have accountability and ownership of it because they're the ones dealing with it every day and know what's going on, and they can have a whole new visual on what they're doing and not just take things for granted and have a better understanding of why we get a deficiency and what the deficiency is for. So that's a wonderful idea that we're very excited about with her.
I think you had mentioned maybe 2 or 3 meetings ago that our regulatory compliance will start to go up eventually.
Yeah.
Maybe starting around November.
Well,
I think you mentioned.
Actually, it's our quality measures that'll start to go up. Our regulatory compliance will go up when we have our next survey.
Okay. Which is,
Well, we're not supposed to, it can be
It just kinda pop it
anytime,
up?
14 months from the last one.
All right.
Anytime from, November all the way up until February, March.
okay. Would the new director of nursing, would she be interested in coming to our committee here and talking about some of the policies and things and her ideas?
I can ask her, sure.
Yeah, that would be great.
She's really...
I'm
she
sure
comes
everybody
from-
would be interested in asking her questions.
Yeah.
We would like to give her a little bit of time before she comes and has, we get some ideas and things
Yeah,
Okay.
she has got a handful.
Maybe September, October-ish.
We'll be meeting with her, I think, next week or.
Yeah.
Tomorrow we'll meet, and we'll chat with her.
Hmm?
Great.
Okay, anything else? Okay,
Thank you.
Thank you very much.
Okay, moving along. Allison, can you give us an update on the department?
I would be happy to. So, just wanted to let everyone know that our vacancy rate for human services, excluding Graysdale, is still running at 12%. We still have around 13 vacant positions in children and youth. And when I say that, remember, it's not the same desk that's been vacant. It changes. So we're continually going through the process of hiring, and making sure that everyone is up to snuff, but I wanted to give you that report. There was a 3-week period last year around this time where Children and Youth was actually fully staffed. And I say that in all sincerity. It was a very short period of time, and then people moved out of state, husbands relocated, etc. But there was a very brief time when we were actually fully staffed. So I just wanted to keep you up to date with that. Also, Northampton County Veterans Affairs, wanted to remind everyone, has a flag disposal box. So that means folks can bring in their flag, their American flag in any condition, and between 8 a.m. and 5 p.m., and there's a box, and you can put the flag in the box, and then the Veterans Affairs Division will make sure they're disposed of properly. So I wanted to remind everyone of that. Let's see. Other than that, I think that I'm here to answer any questions you really have. I mean, you folks are really kept up to date with all the divisions. GRT for Graysdale has come in. That's good. Children and youth placements are still running around 239 a day. That's, ups and downs, but that's been about the average. Graysdale census, you heard, is running above budget at 660. Human Services is moving along. And the building is just fine.
Allison, you have all your division heads staffed?
Yes.
I do have a question. Children and Youth came and told us they have a pretty big audit coming up. How did that go?
Actually, my understanding is the exit interview verbally went well. We do not have anything written to confirm that, but you know how you can tell in exit interviews if it's good or not good,
Yeah.
and this was definitely satisfactory to good. So I'm well pleased with the agency. They really worked hard.
Great. Yeah, I know that Kevin came in last time and said that he was, having to deal with some of the vacancies and the staff, and he had mentioned you guys were deliberating whether or not to expand the positions possibly.
Yes, we are continuing to evaluate. That's very important. And remember, you folks in the budget for this current year approved 4 more additional children and youth positions. So we're running with a new set of children and youth positions for this year as well. So we're always evaluating that. That's very important. Absolutely.
What do you think is one of the biggest reasons for turnover in that division?
Actually, I ran some numbers, and it seems that turnover has to be defined with a few pieces of understanding. If you're talking about caseworkers just flat out up and leaving, I would say half of those resignations are because they went back to school or they relocated. If you're talking about caseworker position change, then you have to think about a supervisor left, and now that caseworker is moved to a supervisor. Hence, that person is still in the Children and Youth Division, but that chair as a caseworker is vacant. So that's what we're finding. We are finding that we've had, because of previous years' retirements, and we had a bunch of retirements in 14 and 15. Because of those retirements, that opened up positions for internal mobility. So we had caseworkers becoming supervisors, supervisors becoming program specialists. So that's what we're seeing. But we're talking about straight up leaving. It's half between relocation and going back to school. And a few that the job was overwhelming, but that's not predominantly the case when you actually look at the exit interviews and inquire.
Mr. Cusick?
Yeah, I had a couple of questions. The one goes somewhat back to Graysdale. There have been 2 more counties that have sold their nursing homes this year. My question is, do you have any idea how that might affect the IGT going forward?
Technically, no, but in general, it would make sense that the less nursing homes in the pool, the less dollars in the pool. So the less dollars in the pool we can send to the feds, so our return will be less. Other than that, That's the logic I would bring to that, but exactly, I don't know.
Okay. Then the other question, again, this rolls back to the state budget. One of the things that I heard has been discussed is a work requirement for able-bodied Medicaid or Health Choices folks. If that were to be implemented, would that be our responsibility to monitor, or how would that be handled?
I don't know if they have thought through that process. In the past, when people have talked about that concept, it would not be the county office. It would be the county assistance office, the Medicaid office that is located in the county. So typically, it's that slice of the state that monitors that. It would not be the county. Anyone that is eligible for medical assistance or health choices is determined by the assistance office, the medical assistance office located in the county. We, as the deliverer of services, have no input into that determination of eligibility or the verification of any requirements based on that eligibility, which would be work.
Thank you.
Yes?
I just, to go back to Youth and Family Services, I know you said we increased last year 4 positions. Based on what Mr. Dolan said, it still seems like a dire situation. So I guess my question would be, is 4 enough? And I know you're looking at it, but I guess the other thing is, what can we do to help the caseworkers? I mean, I can't imagine mentally what they go home with. So I know, I think I asked this months ago, but is there any type of counseling or anything that can be provided to the caseworkers just to help them mentally?
The answer is yes. We do have on contract, well, first of all, we do have the Employee Assistance Program. That we do have. But we also have on contract, specifically through Children and Youth, a specialty contract for trauma and for individuals who go through trauma. So we have that available to the caseworkers. And that has been in place, oh gee, time flies. I'm thinking early 2016 maybe? Maybe even 2015. I'd have to research. But the point is, yes, we have a specialty contract with a therapist who specializes in that type of treatment, type of counseling, type of debriefing. Yes. The other thing is, children and youth throughout the state can take part of, and we do take part in, the University of Pittsburgh's, I don't want to call it, it's an improvement training program. It's an improvement planning process. And Kevin touched on it. He talked about how the facilitators come in and they talk to the caseworkers themselves. What can we do? How can we be done differently? And because they're a facilitator, freedom to speak is there. Then that same group goes to middle management, then that same group goes to upper management, and then there's connection and discussion between all the groups to determine what can be done to assist the caseworkers. Children and Youth budget also includes a specific line item for retention and appreciation of caseworkers, and I mean that in all sincerity. And Children and Youth has a committee where they themselves are very creative with the types of things that help with their morale. Things like Jersey Day, where they wear their football jerseys team to work. Now, granted, it's one of those things where it's in the office. If you need to go to court, you cannot wear your famous football jersey. However, the point is, in the office, something like that. Sometimes it's college day where you wear your alma mater colors, things like that. Sometimes it's a pizza party, specific line items for retention and appreciation of children and youth staff. So there are different efforts on different fronts to make sure we pay attention to those workers and not let them hang out to dry. Absolutely.
Okay, thank you.
We have another line item on your slip here. Can we have a turnover rate line item for each department? What your average turnover is every year? I know you keep track of it.
Turnover, sure, absolutely.
Because I like to see, there's 123 in CYF, and I'm not talking about promotions, I mean real turnovers, and...
Well, I can give you a rate. but I don't have a rate right this minute.
No, I don't
tell
expect you to
that
give it to me right now. I said next month.
Okay.
I'd like to see a turnover rate, and then possibly we can go further into that and see what the major reasons are why they're leaving.
Okay,
You know, we can look into it a little deeper, because when he came here last month with their caseload, I wouldn't work here. You know, the pay scale you give these people, I wouldn't even be here for a week. So,
and actually, I hear you. And
I know
it
they
is-
went to
it's-
college, they get degrees, they go to school, and they come out and they make nothing, they can't even pay their student loans. So, I mean, and it sounded like a terrible job to have. I mean, they like their job, they're very special people who do it and who can handle that every day. But, you know, we have to figure out,
It is hard. It is, absolutely,
Yeah.
it is a hard job. Absolutely.
because they see the
And when you
worst of the
look at-
worst every day when they,
And yet, when you look at our caseloads compared to third-class counties across the state, believe it or not, we are still on the lower end of things, and it is still terrible. So
Right.
I'm just trying to put it in perspective. And I can also tell you that I know in Human Services, we had, in 2014, 32 people leave in 2014. In 2015, we had 32 people leave. In 2016, we had 16 people leave.
yeah, a little less because we had a big turnover when that healthcare stuff came up. Everybody got
And we
scared.
also had, that was 2014.
Yeah,
And then in
14.
2015, we had major turnover in children and youth because of the new laws that went into effect December of 14, January
Those
of 15.
Sandusky laws, I think he was talking about, right?
Exactly. And then you heard Kevin when he talked about not only are those laws new, but the state has put through other laws on top of that, and that's what he was talking about as well. So, yeah, and I am so proud of our children and youth folks because they have survived the onslaught
Right.
of the Sandusky laws, of the new laws, of turnover, and they are just
We like to call
phenomenal.
them unfunded mandates. But, so, I mean, you guys talk, where do these people go? I mean, they go to school, they want to be this, they want to be a youth worker, that's their life's ambition, and they come here and we kill them. What do? Do you know what happens to them after they leave? Do they go to a better paying job in the same field?
Well,
I mean,
like I said, half of them leave because they are going back to school. and
for a
half of them-
master's degree or something?
Exactly, and half of them leave because they're moving out of town or they're moving out of state. And I don't go into
Yeah, I
much
understand.
detail,
I just
but-
wondered if,
but
because
yeah.
people talk, you know, people leave jobs, people mostly know where they're going sometimes. Okay, well, I'd like to see that turnover rate, and if we can keep it going as a line item on here the whole time, it might be helpful in the future.
I'll see what we can do.
Thank you.
Yeah, can I just say something? I had mentioned I went to, and you probably tired of me hearing about it, but I went to that presentation with Supreme Court Judge Max Baer, the Common Pleas judge, you know, anybody in the state, and really, there's a problem. I know we have people saying, well, I'm going for graduate school, there's a problem keeping people in place and in the state with children and youth. And I dare say, and I don't have evidence of this, but people who probably are saying, you know, I'm going to go back to graduate school, maybe part of the reasons that they want to do that is because they want to get in a different career, a different path other than what they're doing right now. That's just speculating, but I just think that that there is a problem. You know, I know that you're saying, you know, people are going for family situations and to go back to school, but I agree with Ken. I mean, there's probably a problem of what we're paying them, what we're asking them to do, and the caseload. That's just my take.
Do you guys have any suggestions?
We don't have any suggestions.
No.
We just want to see the turnover rate, then we'll figure it out in the long run.
Okay.
I mean,
All right.
Yeah, I mean, suggestions, I mean, really, I was surprised. I think you were at that meeting too, Peg, right? Like Judge Baer, which I was just shocked at the length of the depth of information he knew about this problem. And I'm not saying we shouldn't think about it, but I mean, there's people like him, Kevin and Judge Barada go to Pittsburgh to meet with Judge Baer, you know, all the time. You know, Kevin we don't tout him a lot, but he is a real thinker in this industry. I found that out talking to people at that panel, like So, yeah, we got, I'm not trying to say that we shouldn't think about it, but we got some good people, thinking on it too. I don't have a suggestion. Because the problem, what they said is, the people who are the best at this, money is not the ultimate motivator. Like, they want to have they'll be very happy with a middle class, they have no aspirations for money. Riches does not appeal to them. They have that they literally are going for a higher calling. Those people who are the best of this. So.
And actually, that has been bared out in a statewide study
I know.
that was conducted, and
Yeah.
they actually asked the frontline workers, what's more important to you, the money or the this? I'm not saying a fair wage isn't worth it. I'm just saying your comments have been bared out by a survey.
Yeah.
Yeah.
Well, that survey was the topic of a panel discussion that Judge Bear gave. And then I found out after the fact, it was a very cool discussion, and I had a meeting with Kevin, and it turned out that Kevin was instrumental in putting this study together that the Supreme Court judge gave. So that's at the length of maybe the esteem that Kevin is in regards to our folks.
One of the things I know, I mean, at the hospital, I work on a team. It's not a team of 100 people, but when you're down a member, the team in general has to make up for it.
Yeah.
And so, I mean, these guys are on call. Sometimes they have to come into the hospital at 1, 2 in the morning, check on a child abuse case. So, I mean, I think one easy fix to a lot of their work issues would be to fill the staff. And I know it sounds probably real like an easy fix, but it really does go a long way when you work on a team and you have to make up for people who aren't there to do the job.
Which is why we're always hiring and recruiting and filling. And I say that because when I put this together, somebody was probably already hired in children and youth, and it just didn't make the cut for the report. I mean,
Sure.
that we're constantly hiring, constantly trying to and recruit. Yep, absolutely.
Okay. Does anybody have any other questions? No?
Thank you, counsel.
Okay. There's nothing left on the agenda, so we will move for adjournment. Thanks.
Okay. Well, no. Okay. Yeah. I don't have time to do it now. It's always a bit. Okay. Thanks.